Imagine you're driving a sports car at like 100 miles an hour, but the windshield is completely blacked out.
Oh, that is a terrifying thought.
Right. I mean, you feel powerful, you are moving incredibly fast, but you are just seconds away from crashing into a regulatory wall. Welcome to the deep dive.
That analogy, it's perfectly spot on for what we're looking at today.
Yeah, today we're looking at a stack of sources that really challenge how we operate in the modern professional landscape.
Ah,
Okay, let's unpack this.
let's do it.
We are shifting gears from, how to use AI, like interpreting massive data sets, generating formulas, writing summaries, all that mechanical stuff.
Right, the stuff everyone is doing right now.
Exactly. We're shifting from how to use it to whether you even should use it in certain situations, and more importantly, the massive professional responsibilities that lands squarely on your shoulders when you do.
Because the stakes, especially in healthcare administration, are just way too high to operate blind.
Yeah, we are taking a hard look at the absolute necessity of patient data protections, the underlying mechanics of algorithmic bias, and the accountability structures that just have to exist.
Responsible AI isn't just about avoiding mistakes. It's a core standard of professional accountability. I mean, the tools might be new, but that professional obligation you carry, that's not new at all.
So true. But before we get into the terrifying ways AI can go wrong,
Hmm.
we need to realize that you, the listener, have actually been practicing responsible AI use all along.
Well, hopefully you have.
Right, hopefully. But there's a specific framework here. The sources break this down into 3 distinct layers of responsible AI use.
And formalizing these layers is what moves them from just like casual writing tips into rigorous ethical standards.
So let's break them down. What's the first one?
The first is the editing layer. This is basically acknowledging that an AI draft is only ever a starting point.
It's never the final product.
Exactly. It requires human judgment to, adjust the tone and tailor the message for your specific audience.
Because the AI doesn't know your organizational culture. It doesn't know that, say, the board of directors prefers bulleted data over long narrative paragraphs.
Or that a specific department head will just completely reject a memo if it sounds too corporate.
Yeah, exactly.
Yeah.
But the editing layer is really just scratching the surface, which brings us to the second layer, the verification layer.
And this is where things get serious. Verification is critical because we have to understand how these large language models actually function. I mean, they don't possess a database of facts.
Wait, really? I think a lot of people assume it's just searching a massive encyclopedia.
Right, but it's not. Think about how your smartphone's keyboard suggests the next word in a text message.
Oh, yeah. Like when you type, I am going to, and it suggests the store.
Exactly. It isn't actually thinking about the meaning of your sentence. It's just calculating the statistical probability of what word comes next based on billions of other messages.
Oh, wow. So it's just math.
Right. AI models are just that exact same mechanism, but scaled up to an astronomical level. They are just pattern matching engines predicting the next most likely token.
Which means, because they are just predicting the next mathematically plausible word, they can just completely make things up.
Yes. They hallucinate.
They fabricate sources, they misstate historical facts, and they do it with absolute, unwavering confidence. They don't have an internal compass for truth, just a compass for what sounds correct.
And that is exactly why verifying the output is not optional. In healthcare, presenting hallucinated data, it doesn't just damage your credibility, it impacts real lives.
You can't rely on a statistical prediction engine to verify its own facts.
Exactly. Which flows right into the third layer, the translation layer. Even if the AI gets the math right, it completely lacks reality.
So give me an example of that. How does that play out?
Well, let's say you feed your department's weekly metrics into an AI, and it spits out this beautiful dashboard, and it flags a massive, sudden 30% drop in ER wait times for last Tuesday.
Wow, okay. The AI probably highlights that as a huge operational success, right?
Right. The tool mechanically sees the numerical drop, applies the label of efficiency, and boom, it recognizes a pattern.
But you know the context. You know the wait times didn't drop because of efficiency. They dropped because maybe the digital triage software crashed for 3 hours on Tuesday afternoon.
Exactly. Nobody could log the patient intakes. The data collection just stopped.
So if you just pass along the AI's raw data interpretation without translating it through the reality of your organization, you are literally reporting a system failure as a massive victory.
Which is a huge problem. The human has to bridge that gap between what the tool mathematically observes and what that data actually means in the physical world.
But let me ask you this. Let's be real about how people actually work.
Yeah.
If the AI does, like 90% of the heavy lifting, why do we rigorously apply all three layers to every single routine task? I mean, if it's just an internal staffing update, can't we just trust it and save an hour?
What's fascinating here is that the moment you bypass those layers, you are crossing a major professional boundary.
How so?
Because by taking that machine output and passing it along unverified, you are fundamentally presenting an algorithm's statistical guess as your own professional judgment.
Oh, wow. I never thought about it like that.
Yeah, these layers, editing, verifying, and translating, they aren't just for quality control. They are ethical practices that allow you to put your name on a document and say, I stand behind this.
Okay, so those three layers protect the quality of the work. They protect you from a bad output. But there is a flip side to this. What protects the patient's privacy before the work even begins?
And this is where we hit the most rigid legal boundary in our sources today.
Yes, the absolute boundary.
This is a non-negotiable baseline. You must never, ever put protected health information, or PHI, into a general-purpose AI tool.
And by general purpose, we're talking about the free or standard consumer tiers, like the free versions of ChatGPT, Claude, or Gemini.
Right, because these are consumer products. They're not covered entities.
And the key difference there comes down to a business associate agreement, a BAA. Unless your organization has specifically negotiated an enterprise deployment with a BAA, you are not protected.
Exactly. Without that BAA, they have zero legal obligation to protect your data to IPA standards. The moment you hit enter on a consumer tier, that data leaves your secure network.
It is out there in the wild.
Yes. And high-pay standards regarding identifiable health information are incredibly strict. It's not just, names and social security numbers.
Oh, right. The sources have this really specific administrative scenario I want to bring up. Let's say you need to draft a response to a patient complaint. You absolutely cannot paste the raw message.
Do not do it.
Right. You can't paste complaint from Maria Santos, DOB 03151962, MRN 4478823, regarding her post-surgical infection on Unit 3B.
Entering that prompt is a direct high-pay violation. It exposes you and your organization to massive federal penalties.
Here's where it gets really interesting. Think of it like sending a postcard versus a sealed, locked briefcase.
Okay, I like that.
When you drop raw patient data into a free AI tool, you are basically writing PHI on a postcard for the whole internet to process.
Yes, that is exactly what is happening.
But doing this right doesn't mean you abandon the AI. You just have to practice de-identification. You ask the AI to draft a response for a patient regarding a post-surgical infection. You strip out the specifics.
Exactly. The AI gets enough context to work, and the PHI stays secure on your network. You lock the briefcase. This isn't a suggestion, It's IIPA law.
So let's assume you execute that perfectly. You de-identify everything. The data you give the AI is completely clean. You might assume you're totally in the clear, right?
You would assume that, yes.
But our sources highlight a hidden danger. We have to look past the clean data you give the AI and look at the data the AI was actually trained on. This is algorithmic bias.
And this is such a critical hidden danger. AI models require massive troves of historical data to learn their patterns. And human history, well, it's inherently full of societal inequities.
Right. Systemic biases, disparities in care.
Exactly. The AI ingests those historical outcomes and processes them as objective mathematical truths. It doesn't know any better.
And this has already caused measurable harm. The text details this major health system risk prediction algorithm.
Yes, this is a very famous case study.
The goal was actually good. They wanted to identify which patients were the sickest so the hospital could allocate extra resources to them.
But the fatal flaw was the proxy metric the algorithm used. You see, AI cannot measure an abstract concept like health. It needs a tangible number.
So what did they use?
They used healthcare spending as the proxy for health. The logic was, sicker patients naturally cost more money to treat.
Oh, no.
Right. Because historically, Black patients have faced significant barriers to healthcare access. Because they had less access, they generated lower spending, even when they were just as sick as white patients.
So the algorithm evaluated that lower historical spending and falsely concluded that the Black patients just needed less support.
Exactly. It systematically directed vital resources away from the vulnerable populations who needed them the most. And the terrifying part is, no one intentionally programmed it to discriminate. The bias was structural.
It's like using a broken compass and assuming you're walking in a straight line. The tool thinks it's being completely objective, doing the math, but the underlying map it's using is flawed.
That's a great way to put it. If we connect this to the bigger picture, this is where your role as an administrator becomes crucial. You don't need to be a beta scientist auditing the code,
Right.
but you do need an equity lens. You have to actively ask who is being excluded by this mathematical pattern, whose perspective is missing.
So like if the AI drafts a patient satisfaction survey, you have to ask, does this reading level work for our patients with limited English proficiency?
Exactly. Or if it suggests new staffing allocations, does it disproportionately pull resources from high acuity departments serving marginalized communities? You have to interrogate the output.
Okay, so with the hallucinations, the ELIPA traps, and this baked-in algorithmic bias, there is a massive elephant in the room.
The liability.
Yes. When this inevitably blows up, who takes the fall?
The professional standards in our sources provide a very blunt answer. You do.
Individual accountability.
Yes. AI doesn't have a medical license. It doesn't have administrative credentials. You can't depose a large language model in an incident review.
Your name is on the presentation, so you own the errors. It is exactly like signing off on a flawed memo drafted by a human colleague.
Exactly. But placing that entire burden on the individual is just a recipe for systemic failure. Organizations must implement robust AI governance to manage this at scale.
Which means specific pillars, like acceptable use policies.
Right. And these need to be guardrails, not just bans. If you just ban AI, you guarantee shadow IT.
Yeah, shadow IT. When employees just quietly use unapproved apps on their phones to get the job done faster, that is a massive security vulnerability.
Huge. Then you also need data governance, classifying what proprietary data or health data is allowed to go where, and accountability frameworks.
Meaning, if an organization provides zero training, implements no policy, and an employee makes a massive AI error, the liability is shared.
Because the organization failed in its duty to govern the tools. That's why training and awareness programs are mandatory. Every employee has to understand the risks of hallucinations and data entry.
And finally, vendor and procurement review. Administrators have to step up and ask vendors the hard questions. How do you test for algorithmic bias? What are your data protocols?
Because if you fail to ask those questions before signing the contract, you are literally purchasing a liability.
So what does this all mean? Using AI uncritically doesn't just risk your personal reputation. It creates massive organizational liability. You could violate federal laws, perpetuate bias, and legally expose your whole hospital.
This raises an important question for how administrators navigate this. The best ones, they don't hide from AI out of fear, but they also don't trust it blindly. They just understand its limits.
It's a massive shift. We started this deep dive exploring the ethical layers of editing, verification, and translation.
The foundational practices.
Right. And then we established the hard legal boundaries of HIPAA, the hidden traps of algorithmic bias, and finally, ultimate human accountability. You are the vital human in the loop.
But consider this to end on. We've clearly established that the human operator is entirely accountable for the AI's mistakes today.
Right.
But as these models become deeply integrated into healthcare and statistically more accurate, will we reach a threshold where failing to use AI to verify your own human work becomes a breach of professional ethics?
Wow.
Right. How will our definition of liability shift when an AI is no longer viewed as just an optional assistant, but is legally demanded as a mandatory second opinion?
That completely flips the equation. We spend all our time worrying about the AI making an error, but the future liability might stem from not asking the algorithm for a safety check.
Yeah.
That is definitely something to ponder.
It really is.
Thank you so much for joining us on this deep dive. As you return to your data sets and your strategic plans, remember to keep your equity lens sharp, keep that patient data completely locked down, and if you're going to drive that sports car, make sure you clean the windshield first. Catch you next time.